Well, hello everyone, and welcome to Walls of Wellness. I am super excited to see you all this evening on Wednesday, October 23rd, 2024. I am currently waiting for my guest, Dianne Hyman, to come in. So while I am waiting for her, I'm actually just going to take a moment and read you her bio. Incredible. Up and as always, whenever I'm doing a live show, somehow I end up with some background noise. So let me go ahead and take care of that. So meanwhile, in the chat, as you are always climbing on, let me know how you're doing today and let me know where you are coming in from. All right. Meanwhile, I am going to shut down and find this background noise that's making its way into my ear. I hope everyone is having a great day. Let's see. All right. Every time I think I've shut it down, it still makes its presence known. All right. I might have gotten it. And let me see if Dianne has made her way. She is. I just need her to put her camera on. And once I see her camera on, then I know that she is here. And meanwhile, in the chat, I just ask you to say hello. And again, just let us know where you are coming in from. All right, I'm getting ready to pull Diane up. Oh, she dipped out on us, so she'll be back in a few moments. All right. So, in the meantime, like I said, I will pull up her bio and read that for you. And you can get to know her personally once she gets on here. So, Diane is championing, and I want everyone to make sure you go to the YouTube channel at Ask Dr. Walls 525 because there's a link in the write up for voices.cancer.org. And it is very important that there is a survey that Diane is going to talk to you about when she comes back on. And it's important that people participate in this survey. Been on some of my other shows, you've heard people talk about clinical research and how important it is that people are participating in clinical research so that actual and factual information can be given. So again, let me just give you a little insight into who Diane is. So Hyman is a certified oncology nurse, an advocate, and a transition care manager at the MD Anderson Cancer Center at Cooper University Hospital in Camden, New Jersey. She works closely with a multidisciplinary team overseeing the complex coordination of care of cancer. Excuse me, she was just sending me a message. Overseeing the complex coordination of care of the cancer patient. Diane is championing the campaign for the Voices of Black Women, which is a groundbreaking initiative led by the American Cancer Society. The campaign is calling on Black women from all walks of life to join the movement. This isn't just a study, it's a collective commitment to understanding and improving the health of Black women across the nation. With over 24 years of experience as an oncology certified registered nurse and a community educator, Dianne Hyman works extensively within the minority communities. A passion for the underserved, she is dedicated to promoting the early detection and screening of breast, cervical, prostate, and colorectal cancers. She works widely within the minority communities, educating and assisting with screenings for these cancers. In 2001, through her work with disparities in breast cancer patients, Dianne was led to formulate a breast cancer support group, Sister Will You Help Me, for women of color and faith. Through the years, the group has provided support, education, and serves as a place of hope for many survivors. In addition, as an American Cancer Society spokesperson and champion, Dianne is compassionate, supportive, and encourages survivors to connect with ACS for support and guidance. Furthermore, her passion for prevention and breast cancer disparity has led her to become an ACS, which is an American Cancer Society ambassador for their Voices of Black Women campaign. So she will be joining us shortly. She is having some technical difficulties, so she just sent me a message. Um, so we're looking forward. Okay, somebody just let me know that you're hearing an echo. So let me see technology wise what's going on. So just hold on me one moment. All right, let me know if that is better. All right, it seems better on my end, and I apologize. Hey, good evening, everyone. Now, hopefully, Diane will be able to figure out what's going on her technology piece. But in the meantime, I want to, and thank you for the people letting me know that you could hear the echo too. I could hear it too, so I'm glad it was able to be shut down. All right. So yesterday I was looking on a post from another friend to the show, Dr. Nia Bailey, and she was just recently recognized for her work that she does with breast cancer. And on one of her posts, she had some very interesting findings. And I'm just going to read the portion of her post, which I was able to get a screenshot. It said, "We are dying, and that's no exaggeration. Post pandemic, we are facing an epidemic breast cancer. This insidious disease spares no one, women and men of all ages. Um, This insidious disease spares no one, women and men of all ages, races, religions, and sexual identities, as faced with the diagnosis of breast cancer. 1 in 8 women will be diagnosed with breast cancer in their lifetime. 1 in 8 women. 1 in 800 men will face a breast cancer diagnosis. And that's something that's so important because so many times when we think of breast cancer, we tend to only think of women. We don't tend to think of men. So 1 in 800 men will face a breast cancer diagnosis. Black women are twice as likely to die from breast cancer. In 2022, over 40,000 women lost their lives to this disease. So, this is something that definitely needs to be addressed. Obviously, it needs to be talked about, which is why we're talking about it now. Excuse me 1 second while I try to see if I can help Diane get into the room. Um, Technology is great when it works. All right, let's see if that helps. Um, and let me see what else she wrote in here. Okay, so she began talking about, Dr. Nia mentioned some of the people who passed away this year. The other thing with breast cancer is that more and more younger people are being diagnosed with it. So it's not something that we need to wait to assess. We need to make sure that we are getting checked out, and we need to make sure that we are encouraging women, friends, loved ones, coworkers, neighbors, to get checked out as well. And here I'm encouraging you, and I may not know some of you, right? But I care about your health and your well being. Dr. Nia mentioned several people in her post, and one person was diagnosed with breast cancer at age 26, and this person passed away at age 30. Another person passed away at 33, someone else at 38, and another person at 42. And she mentions her uncle who passed away from breast cancer at 58. So there's so many different ages and people, and so it becomes incredibly important that we are making sure that we are mindful of our health and that we are also encouraging the health and well-being of others. All right, I'm super excited. I think she's ready now. Let's see. We got her. We got
I
her.
am here. Good evening, good evening, good evening.
Good evening. They were holding on. I
They
was
were
trying,
holding on.
they
Thank
were.
you. Thank
Okay.
you so much. And my
Yo,
apologies. It's a little
um,
technical difficulty this evening.
look, it happens, but you all good. You fell within that timeline. It wasn't like in college where if the professor don't show up in 15 minutes, people running out the door. So they still.
Thank you.
All right. Well, welcome, Diane, to the show.
I
It's
am so delighted, Dr. Walls, for the invitation.
Yes. Well, when you told me about the initiative that you're working on, and I read them your bio, which I know is only a snippet of the work that you have done in your personal story. And also let them know that the link to Voices is in the write up on the YouTube channel, the Ask Dr. Walls 525. So to come on over, look in the write up, click on that link to do
Yes.
the survey. But we're going to back up a little bit, and I'm going to have you tell the people about yourself and why this work is so important to you.
Awesome. Yes. So again, I'm Dianne Hyman. I'm an oncology nurse at Cooper University, the MD Anderson Cancer Center in New Jersey. And I started working with breast cancer now, 24 years of all of my tenure at Cooper has been in oncology and with the primary focus on breast cancer in the earlier years. And it was with that work, working with an awesome team there, seeing minority women, especially Black and Brown women, such as myself, living in the inner city, Camden, New Jersey, where the institution is, just began to see women and understanding breast cancer and being new to oncology at the time,
Mm-hmm.
seeing women being diagnosed late stages, having lack of resources, and all of that that came with that. And I just really was moved by it all. I always tell the one story of Hollywood, I called her. She was a patient that was diagnosed and was under get ready to go in the hospital for mastectomy, having her
Mm-hmm.
breast removed, and was living with her significant other. And the day before she's going to be admitted, she literally had the impression she hadn't shared with him that she was having a mastectomy, thought that she was going to come home with perfectly reconstructed breasts.
Mm.
And that was pivotal for me. That was just one of many instances like, wow, we need a lot of education here,
Mm-hmm. Mm-hmm.
to let her know, no, he's going to know that you had a mastectomy.
Yeah.
So it was just seeing women similar to her and just being diagnosed late and not having the resources that they need really just stirred up my passion for women and breast cancer and in particular that disparity that comes with it.
Mm-hmm.
And so over the years, I've been able to, do some things in that arena that I'm grateful for.
Mm-hmm. So tell me this. So then you end up creating this organization. How did that come to pass?
So again, seeing all these women And at the time, we actually did a focus group. The oncologist and the team that I was working with got some of
Mhm.
the survivors together, the women that were undergoing breast cancer, and like, how can we better help you? Because
Mhm.
the disparity was so real, in our face, in there in the city.
Mhm.
And they, again, was lack of resources, lack of support, not seeing women that look like myself,
Mhm.
not being able to share because they weren't sharing with one another. And so out of that, Sister, will you help me? And it's funny because I had gone on a women's retreat with my church. And if you've ever been on a retreat, you hear how women share their stories, their
Mhm.
testimonies. And I was hearing all of these women share about their cancer, who I didn't even know had cancer. Again,
Mhm.
oftentimes we don't share. People in your church may not even let you know. But in this place, on this retreat, the women were sharing. And one night, the guest speaker had titled her message, Sister, Will You Help Me? And
Mhm.
for that, that was confirmation. So I came back
Mhm.
and I was like, yes, my sister, I will. I have to
Mhm.
do this. And that's been 23 years ago.
Wow. Wow. What's that been like for you to run this organization?
It has been, it's very fulfilling, but it's also bittersweet. I mean, I've
Mhm.
been through my share of funerals. I will say
Mhm.
that.
Mhm.
I've hit different parts, in my journey as an oncology nurse, of where it was weighty, you
Yes.
know, trying to carry in the weight of seeing what I was experiencing. But I always tell the ladies, for as much as I have poured out to them, they truly have poured into me.
Mhm.
Their resilience and their endurance and all their faith,
Mhm.
um,
Mhm.
and just to be a part of so many women's journeys has been an amazing blessing.
Yeah. Yeah, it's interesting. So Dr. Nia Bailey, she does a lot of work with cancer, breast cancer specifically. And many times on her posts, she'll talk about, and I read some earlier about people who she's lost along the way. And it is heavy. And
Yes,
then there's also those who are still with us. And
yes,
so, right there, you have your trials and you have your triumphs. You have your tears of joy. You have your tears of grief and sadness. Go
yeah.
ahead. It looks like you have something. Go
Yeah,
ahead.
with the beauty to that is that we have made great strides in breast cancer.
Mm-hmm.
Women are living longer, even women that have what we call metastatic disease, where the cancer has spread to other parts of their body. We have treatment options where we didn't have before. And
Okay.
so we have made great strides in that, the medications and research and all of that. So we're living longer. We're living
Mm-hmm.
longer,
Mm-hmm.
even with the disease. And so that's a blessing.
Why
But
do you
unfortunately, we have lost, way too many women to breast cancer.
what do you think it is? What have you heard over the years as to why some people delay in getting checked or getting help and so forth?
Dr. Walls, I have heard and witnessed like so many different things that still, it's hard. Sometimes we're paralyzed by fear.
Mm-hmm.
You want just fear that just refuse to move. Know that
Mm-hmm.
they may feel something, may have had an abnormal mammogram and fail to come back for
Mm-hmm.
additional testing, fail to come back for the biopsy.
Mm-hmm.
So fear is huge.
Mm-hmm.
We also have the social economic barriers. I mean, if you are a single mom, working, you don't have time. We don't make ourselves a priority sometimes.
Mm-hmm. Mm-hmm.
Um, you know, I've even had some instances, and this may even sound crazy, where I had two sisters that are diagnosed with breast cancer and their mother refuses to get screened. So
Wow.
it runs the gamut
Yeah.
of as to why we're
Yeah.
we're stuck and why some women choose not to screen.
Mhm.
And I
Mhm.
do I also say, don't assume those closest to you are getting screened.
Go ahead.
uh,
Yes.
Sometimes we just assume that our
Yeah.
sisters are getting screened, and you'll be
Mhm.
surprised,
Mhm.
that in fact they're not.
Yeah. Yeah. I know one of the things, and I mentioned Dr. Bailey a lot because we've had a lot of conversations, and this is her primary work area as well. She did an event in April 27th, and one of the things that she offered were free screenings. at the event, and they used a system called BEXA. Are you familiar with BEXA?
No.
Okay, and so BEXA is about the size of a computer mouse. All right, so it's
Hmm.
about this big, and they run it over the breast tissue because what they found is that women of color, their breast tissue tends to be denser.
Yes.
And so you want to say, speak
Yes.
to
So
that?
what's that sounds like it's like an ultrasound, similar
Well,
to an ultrasound to me.
similar.
But
Mm-hmm.
yes. So yes, black women, we tend to have more stromal tissue in our breasts, that
Mm-hmm.
makes it more dense, and mammograms are harder to pick up through the dense breasts. And
Yes.
now research is even showing that for whatever reason, dense breast increases your risk of getting breast cancer. And so it's
Mm-hmm.
not the size of your breast, your breast being, a larger cup or anything. It
Mm-hmm.
literally is the density of the tissue for imaging,
Yeah.
and that is also contributing to increasing our risk. So
Yes.
women that have an increased risk of breast cancer, if you have dense breasts, you should also, it's recommended that you get the ultrasound as well.
Mm-hmm. And so how can people find out? How do I know my breasts are dense?
From an initial mammogram, and now it is regulated that the radiology, the governing body of radiology, it will literally state in your mammogram report that you have dense breasts. And it's a grading system,
Mm-hmm.
low dense all the way up to extremely dense breasts. And
Okay.
it is recommended off of that you get additional imaging with an ultrasound.
Okay. So as you're saying, I'm thinking about Dr. Natasha Ramantal, who's a friend to the Sisters for Harmony Vodcast, gives us all this wonderful information. She has a medical tourism channel. And so we were talking one night about her potentially doing a book, and I know she's laughing if she's listening right now about her doing a book of questions that people should ask their medical providers and so forth. And I'm just thinking the importance of asking for clarity about the density of
Yeah.
one's breast. That would have never been a question I would have thought to ask
Yes.
during any of my checkups.
Yes,
So,
exactly. And you don't know, if you don't know, you don't know.
hmm,
And so that's why it's so important for us to get the necessary education that we need to,
yes,
help each other, help, because, now that we know, we can tell the next
exactly,
sister, to make sure.
exactly.
And just advocating for ourselves more. I always tell my ladies, you are the head of your healthcare team. We're here to support you. We're here
Come
to,
on.
care for you and do what we do, but you are the head of your healthcare team. So, take ownership in that and know that you
Yes,
have a right to ask
yes.
all the questions. You have a right, for a second opinion,
Mm-hmm.
if you so desire. Uh,
Mm-hmm.
yeah. And so, yeah, we really have to be more, our voice. We have a voice and it matters.
Yes, I'm looking at right voices for the future. My voice, our future.
Yes.
Right, exactly. And
Yes.
Dr. Ramantal does happen to be joining us at the moment. And she says, I have dense breast tissue and always have to have an additional mammogram after during my annual exam. Thank you for
Yes.
sharing that. Yeah. So that's important for people to know. And even just in this conversation, normalizing having these types of conversations, right? So
Yes.
many times historically it was that you keep these things private, you don't tell anybody. And there are some things, yes, that we do keep private within loved ones and so forth. But to be able to share the knowledge to say to someone, have you had your mammogram this year? Have you found out whether or not you have dense breasts? Make sure that you ask and get that clarity. Be an advocate for your health, right? Be the head of your healthcare team. It
Yes.
is so important because so many times people are finding out information further along, and certain precautions or treatments could have been put into place earlier if, as Dianne talked about, we had gotten past some of those initial hurdles, be it fear, just not knowing to check out, not knowing where to go. Now, let me ask you, as far as age is concerned, because one time it was you don't have to worry about a mammogram until you get to be a certain age.
Yes.
But as I read at the top of the hour, Dr. Imani Bailey, she was telling us people who passed away at 26 and
Yeah.
28 and 32 and so
Yeah.
forth.
And it's so because the governing bodies that like the American Cancer Society or, the NCCN guidelines, which is our National Comprehensive Cancer Network, all of these different governing bodies sometimes have some differences in when they say we should start screening. I know
Hmm.
now the American Cancer Society has recently said between ages 40 to 54 that you can, now is it? Yeah, no, 40 to 44, you can choose to have a mammogram every other year.
Hmm.
45 to 54, you should go annually. And then 55 and older, you can go annually or choose to go every other year.
Hmm.
Whereas before, and some people might not agree with that.
Hmm.
It used to be at the age of 40 that you would get an annual mammogram. We do tell, and that's for average risk women, not high risk. So average risk women, right now, you can choose to have a mammogram every other year between 40 and 44. If you
Hmm.
have a family history or personal history considered high risk, of course, you should be screening annually. And we also use the rule that if you should screen 10 years earlier than the youngest person in your family that had breast cancer. So if you had a sister
Oh,
that had breast cancer at 42, you really should at least get a baseline as early as 32.
wow.
So there's definitely encourage people to speak to their healthcare
Hmm.
provider as to, when and how frequently.
Hmm.
But
Thank
mammogram
you
every
for that.
year.
Yeah, thank you for that because I know a lot of times people won't share their medical history with family members.
Hmm.
They'll say that they're too young or they're trying to protect them emotionally and so forth. But there is that hereditary factor that needs to be taken into consideration so that things can be checked out sooner than later. And
Absolutely.
yeah, go
So
ahead.
that we're part mom and dad, so you got to look at dad's side of the family as well. Although
Yes.
we'll focus on what's running in mom's side of the family in
Mhm.
regards to breast cancer, but it's important that we're looking at both sides of our families as well.
Yes. And right, this is men and women. And initially, as I was sending out the link, my mind was, let me just send it to all of the women that I know, even though intellectually I know men are diagnosed with breast cancer as well.
Yeah, absolutely. Much smaller. I think women are 100 times more
Yeah.
uh, incidence to getting breast cancer, but men do about one
Yeah.
in about 1 in 800, you know,
Yep.
lifetime risk.
Yep.
So yes, absolutely. But if they have that mutation, the gene,
Mhm.
that would increase their risk in running their family, and they can carry the gene and pass it down to their
Yeah.
children. So yes,
Yeah, this is a
absolutely,
discussion. So, right again, if you're having family discussions, don't think to leave your sons out of the discussion. This is something that the whole family needs to talk about.
absolutely. And just
So,
go ahead. I'm sorry.
no, 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 you go ahead.
I was just going to, piggyback on what you said. Just as a race of people, we just generally have not. And do you know what your great grandmom passed away from? Do you know what
Right.
your aunt passed away from? Like we
Yeah.
just, as a race of people, not necessarily have always been forthcoming with
Hmm.
what diseases in general, not just cancer, but diseases in general, run
Exactly.
in our family.
It's the absolute truth. I'm the primary caretaker for my mother, and there are things that I don't know if it ran in that side of her family because the record keeping on that side wasn't as great as the record keeping on my father's side.
Yes.
So we're discovering things in real time, which can be very stressful
Yes.
and puts a lot of question marks. Are these things that like I need to worry about? Are these things that my brothers need to worry about? Or are these things that are just unique to her life experience?
Yeah.
We don't know because we haven't been able to track it. But it is very important that you do have these real life conversations to make sure that you are getting the checkups. Like I said, I appreciated going to the event in April and experiencing the BEXA type
Mhm.
mammogram, which can be done in addition because it is designed to work with and for individuals with
Yeah.
dense.
Correct.
right, with the dense breast. And now it works as a supplement and or a complement to the mammogram and the information that the doctors get. They do it right then and there, and within 48 hours you have your report in your email that
Wow.
you can then upload into your health portal and share with your primary care physician or
Wow.
your OBGYN.
Yeah. And you need to do that in conjunction with the mammogram because today
Correct.
mammography still is the gold standard. But you,
Yep.
of course, can have that ultrasound. And then some women at high risk may need an MRI as well.
Good information. Good information. Now, is insurance covering all of these things to your knowledge?
To my knowledge, they should. You should absolutely for dense breasts, your insurance should cover the ultrasound, and then
Okay.
for women that meet criteria considered high risk, MRI.
Mm-hmm.
But you can have your provider look into it and get it approved. Call your insurance company yourself. We gotta
Yes.
get that covered.
That's right. That's right. So now you've been doing this work for over 20 years, and now there is this new initiative. Well, it's new to my awareness. I
Yeah.
don't know how new it is. Called
Hmm.
Voices. What is that? What is that about? And
Yeah.
why are you connected with it?
Yes, I'm super excited to be an ambassador. Actually, it's an American Cancer Society initiative that just came out in May, and
Mm-hmm.
the focus is the goal is to recruit 100,000 Black women to take partake in this study. It is not a clinical trial.
Mm-hmm.
There's no blood work, there's no medication, anything like that. It simply is a series of questionnaires gathering all of this information from 100,000 women.
Wow.
Right now, there's 20 states that is included in this project
Mm-hmm.
to hear your voice there. And the questions are it takes a minute, but the
Mm-hmm.
time, it may take you about an hour to complete the questionnaire, but they're
Okay.
going to follow you long term for up to like 30 years. You'll
Oh
continue
my
to get
goodness.
questionnaires. It's for women between the ages of 25 and 55 who have not had breast cancer. So
Okay.
I'm still working on the survivorship side with all of my survivors, but this is exciting for me because it's on the prevention side now.
Mm-hmm.
What is there anything that we can track over
Mm-hmm.
time that is increasing our risk, increasing our mortality rates in breast
Mm-hmm.
cancer? Is there something underlying that's predisposing us to, the aggressiveness? Because Black women, young Black women, have generally a more aggressive type of breast cancer. What
Okay.
is that? Can we look over time? Is it diet? Where were you? They ask you all kinds of questions, your
Mm-hmm.
family history, diet, exercise, just very in-depth questionnaires to gather all this information from Black women,
Mm-hmm.
follow you over time, revisit if anything's changed in the next year when we send you a questionnaire, where
Mm-hmm.
you're diagnosed with breast cancer, somebody else in your family had breast cancer, and just follow this long term. And it really
Mm-hmm.
is not for us today, but definitely will impact our future generations. And that's what we, have to focus on. When I hear, oh, it takes so long to complete, like, this is just a moment in time that is
Yeah.
have a lasting impact that will impact our future in breast cancer for Black women for generations to come. So I'm super excited to be
Mm-hmm.
an ambassador for this program, and
Mm-hmm.
just trying to, or again, we have a voice and it matters, and they won't know. And that's the thing.
Mm.
Historically, we as Black people, for various reasons, don't
Yeah.
participate in research and haven't
Yes.
participated. And so we're trying to overcome that as well,
Yes.
because they're not going to know what's specific for us if we're
Yes.
in the research.
Yes. Let me ask this question and I'm gonna come back to that piece about the research. So Dr. Ramantal asked any information attributed to deaths at a younger age with breast cancer.
So I research, we do generally, Black women have younger Black women. It is research has shown that they tend to have a more aggressive type of subtype of breast cancer, something
Okay.
called triple negative breast cancer. So
Mm-hmm.
which is tends to be more aggressive and less treatable options with that type of subtype of cancer. And we
Mm-hmm.
do see younger Black women tend to be more triple negative.
Mm-hmm.
So just the biology of our disease, they need to look at and study and see, and that can be contributing to our higher mortality rate that we have.
Okay. So it's interesting. So my father, back in the 60s, before he went to veterinary school, he did cancer research. And then my father ended up transitioning from a type of cancer, which I'm blanking on right now, but it was abnormal. They said it was normal for people who had been in Vietnam, but abnormal for those who hadn't. So, and he wasn't. So it was like, okay, where and why did he get this particular type of
Hmm.
cancer?
Hmm.
But I remember my mother saying, like, this is over 40 years ago, 30 foot, like, how come there hasn't been more findings, understanding?
Yeah.
Because it was the mid 60s when he was doing cancer research, and now here we are in 2017 with still so many, because that was the year he made his transition, with still so many question marks.
Yeah. Yeah.
And you mentioned the fact of research, and I know Dr. Kristen Motley, who's also a friend to the show, she was talking about a lot of, um, she was talking about a lot of research that still needs to be done and participants that
Yeah.
are needed specifically from Black and Brown communities. And like you said, there is a tremendous understanding as to why people are hesitant
Yeah.
to participate in the research.
Yes.
However, if we don't participate in quality, healthy, ethical
Yes.
research, right? We're not talking
Yeah.
about the unethical
Right.
stuff. We're
Right.
talking about the ethical stuff where you are being informed of what this research is about. You are given permission, usually, to stop at any point in the
Yes.
process, right? So that answers can be found, of course, ideally now while we're here,
Yes.
but also for those who come after us, children, grandchildren, great grands, and so
Absolutely.
forth. Go ahead. You were about to
And
say
that is
something.
just how the BRCA gene, the breast cancer gene, was found because Ashkenazi Jewish women participated in this study, and they
Hmm.
found that this gene was prominent a lot of white women participated in the study, and they were able to extrapolate that these Jewish women that primarily had this gene.
Yes.
Till we can participate in genetic testing. Women that have had breast cancer, you should get genetic testing if you meet criteria, have a family history, diagnose young. As they gather, or is there a gene specific for Black people?
Hmm.
Until we gather enough information and able to do research in that area, we won't know. And
Right.
that's just for us across every, not just cancer, but just we don't participate in research in general.
Hmm.
Black
Hmm.
people, our high blood pressure is different than
Yes.
other cultures.
Yes.
How are we going to find out what blood pressure pill works best for
For
us? And
us.
you know,
Hmm.
things like that. And just as of course we have to get through the mistrust of
Yes.
the research community and healthcare
Yes.
in general. Some myths still hold us back as well, and just
Hmm.
really education and being informed and coming to the table in studies such as this, that is just a series of questionnaires.
Yes.
We
Yes.
should be able to get these 100,000 women, but we're struggling a little bit. We've
Yeah.
only been out since May, but again, it's 20 states that we're trying to recruit. But yeah, so we have to continue this discussion. We have to keep this dialogue going. And to your dad's point, a lot of research, tons of money goes into breast cancer research. How
Hmm.
much money go into prostate cancer research or some other cancers? Not
Hmm.
as much, right?
Yeah.
So
Yeah. I love the fact, Dr. Ramantal said she didn't realize at first that there are no labs or experimental meds with this particular research study. There are only questions. It's
yeah.
only taking your time. And thank you, Deanna Freeman, who said, yes, very in depth questionnaire, but necessary questionnaire. And so, right, you taking a few minutes, meaning
Mhm.
60 minutes, 90 minutes, that, okay, so you can't watch a show for that amount of time. You watching whatever show you're watching or scrolling for 90
Yeah.
minutes
Yes.
is most likely not going to save someone's life or contribute to society in a positive way. But you taking that 60 to 90 minutes to answer this questionnaire may change the course of so many people's lives.
Yes. And
It,
that's the message. Absolutely.
yeah, yeah,
Absolutely.
definitely. I'm looking, Dr. Ramantal says this helps Black women, especially with the deep mistrust in the US, with how we have been mistreated historically. I would like more information to also share on my platforms as well. Oh, thank you, Dr.
Thank you.
Ramantal.
Yeah.
Yeah. So
You
I
can
put the link in the chat for
have
people. You can take a
amazing.
look. That link is there. Again, the link is also on the write up on the Ask Dr. Walls 525 YouTube page. You can click on that link. It is active. It will take you directly to the page. Let
Yes.
me show you. Um, I'm going to pull it over so we can see it.
It should be voices.cancer.org, I believe.
Yep. So there we go. So that's what that page looks like. And then Diane, you want to kind of tell them what they can expect as they're going through this?
So you take the initial assessment to see if you qualify. Again, you have to be 25 to 55 and not have had a personal history of cancer, other than
Mm-hmm.
maybe a squamous cell skin cancer. I think they will allow that in, but no history of breast cancer personally. And
Okay.
then once you meet criteria, they'll take you to the link to complete the survey. You don't
Mm-hmm.
have to do it all in one setting if you don't have the time, but at least, again, it should take you about an hour. But detailed questions about your personal history, exercise, diet, your family, your mom's side, your dad's side, where were you raised? Food insecurities, it covers the gamut, very, very. And then some people say, well, why so many questions? This has nothing to do with cancer. But again, we're grabbing all of this information, and
Yes.
is there some commonality, down the road as we continue to reassess over the years
Mm-hmm.
and see what comes out of it. So
Yeah.
very excited, very exciting work.
Yeah. And so you're going to need to create an account. So, go through your join us today, create your participant login, and then just follow the prompts as you go. Okay. And so, and as Diane said, a lot of times when we don't know something, we have to cast a wide net until we can figure it out and find out what are the themes, what are the commonalities, what do we see, right? That's the research part of it.
Yeah.
So the same way you cast a wide net if you're dating, right? You may end up dating a whole bunch of people, and then you figure out whether or not that's the one that works. What's the theme? What are the things that I like? And so right? But we have to do our research and we have to see what is common. What are we noticing about Black women? What
Yeah.
are we noticing about their breasts? What are we noticing about breast cancer within Black women? What are we noticing about diet? Right? We're in a process of discovery. And
Yes.
sometimes when we think of Western medicine, we think that they know everything, and they don't know everything. They've learned some things over
Right.
time, and some things they're still learning.
Right.
We're still uncovering, hence the research. Go ahead, Diane. You look like you're going
I
to
was
say
going to
something.
say, you were when you brought me to it when someone had mentioned about younger women being diagnosed. Was it something, 20 years prior? When did this fast food and changes in our diet and all of this take place that,
Mm-hmm.
maybe can be contributing to our younger sisters today having this more aggressive type of breast cancer? We don't know, but
That's right.
something turned on that all of a sudden younger Black women have a more aggressive,
That's right. That's right. What was activated?
what was that?
Mm-hmm.
So
Yeah.
yeah. So know your body. Just some
Mm-hmm.
nuggets. Absolutely know your body. You have to
Mm-hmm.
know what your breasts look and feel like normally, so that you're able to to know when something isn't right. Listen
Mm-hmm.
to your body, know your body, and
Mm-hmm.
get checked out. Don't, if you're young, don't take no for an answer. I have, horror stories where, she was 29 and went to her primary care and they waved her off, said nothing was, you're okay. Here, in fact, by the time she does get diagnosed, it's
Mm-hmm.
more aggressive and later. So you
Yeah.
have those stories as well.
Mm-hmm.
So our young women as well, don't take no for an answer. You
Yeah.
think something is wrong.
Yeah. And I think that's the other important part about having these types of conversations here. And for those who are watching this, sharing it with someone else, so that it might spark that thought in them. It might give them that extra courage to
Yes.
say, you know what, I got this response, but honestly, in my gut of guts and my soul of souls, I don't feel like that
Yeah.
was the truth, right? This is why they say get a second opinion. Well,
Yeah.
guess what? You can get a third opinion as well. You can have the conversations with your primary care physician. If you have a therapist, have a conversation with them, friends, family members, your support network. If you go to churches or synagogue or so, right? Talk to people to find out who do they go to? Who are the medical people that they trust? And work to get an appointment there. I know when I was dealing with a health issue with fibroids back in 2015, honey, I was ready to go to the emergency room. I just
Yes.
take everything right now because this is a hot mess and my quality of life is at about a 2 right now. And I can't, I'm a high functioning person. And I called my girlfriends and I was like, who is your OBGYN? Because I need
Have to get there.
someone immediately. And one of my girlfriends was like, let me make a call. I got you. And she did. And that person was able to slide me in on their schedule.
Yeah.
And we were able to do what was necessary. And what, 3 months, 4 months later, I was having surgery,
Very.
you
Yeah.
know.
And in regards to screening for mammogram, don't let lack of insurance or being uninsured deter you. There is a program in every county throughout this nation where you can get a free mammogram. We have
Mm.
to disseminate that information. We have to know, the resources and let them know you have access to a free mammogram if you're uninsured or underinsured. That should not be a barrier.
So where do they go to find that out? Are they calling the American Cancer
They,
Society? Are they
you
calling?
call the American Cancer Society. You can ask your primary care to help you. Any
Mm-hmm.
breast cancer, any cancer center should have access
Mm.
to that information.
Mm-hmm.
Where you can go for free screening.
Mm-hmm.
Yeah. So
Okay.
yeah, Department of Health. You can get that information to where you can go for free mammogram screening in your area. So
Okay.
definitely not. We have other barriers, but lack of insurance, we gotta make sure that we're not using that as one.
As one of them.
And
Yeah,
yeah,
for sure. And I know here in Philadelphia, I've been to the American Cancer Society and they were so helpful. I mean, I literally just walked in from off the street and I
yeah,
was like, I'm having an event. This was a couple of years ago. I said, I'm having an event. Do you have any information you'd like me to put out at the event for people? And they were like, yeah, sure, and they were,
right.
handing out that. So utilize, many times there's so many services where people are just literally waiting for people to ask for help from them. They exist for this purpose.
Mm-hmm.
So, we talk about girls' trips. We talk about things. What if we were to partner up with girlfriends and say, let's make our medical appointments
Yes,
and right, let's go have our mammogram Monday. Let's go
yes,
make
yeah,
let's make this a thing where we are taking care of each other. I have another friend. She has a program called Sick with It, SICKWIT, IT, Sick with It, because she just became so frustrated with the community of artists who were really kind of living under the starving artist
mm-hmm.
umbrella
Mm-hmm.
and not getting the health care services that they need. And so many people under the age of 55 dying
Yes,
with different things, be it cancer. high blood pressure, as you mentioned,
Mhm.
right? Diabetes, all types of things, because they weren't getting the medical help that they either needed or they didn't know that they needed because they hadn't gotten the yearly exams and so forth. So, taking care of yourself, as Dianne has mentioned, being an advocate for your health is primary. Again, I love how you said it. You are the head of your medical team and creating that effective team to win the gold every single time. And the gold is your life and your
Yeah.
health.
Yes. Absolutely.
In,
Absolutely.
any other thoughts, any other resources you want to make sure people are utilizing?
Of course, you are again your number one advocate. Ask. Just you have to. We have to, check within our families, our closest,
Mm-hmm.
making sure that we're getting the services that we need and being that resource, being that advocate, and being able to direct people. If I don't know, I'm gonna find out for you type of
Yeah.
mentality. We're gonna find this out together, and help, because resources are there. I can't say that we don't have any resources. There are a lot of resources in our
Mm-hmm.
communities. It's disseminating that information, and that's for housing and assistance, and all of those things. There are some resources available, but people just don't know
Yes.
to
Yes.
be able to have a navigate. And it's tough navigating the healthcare system. Everybody's not computer savvy.
Mm-hmm.
Everybody's not you know as quick to go on your phone and be able to find all of these things that some people struggle with that. Even with this
Yes.
survey is only done electronically. I may have
Mm-hmm.
somebody that got to help walk through it because
Yes.
they aren't technically savvy enough to kind of do that themselves, or at
Yeah.
least system, they at least get into it and register, and then they could take it from there. So
Yeah.
we can't be, people still need help in certain areas and certain things, and we're so quick to make everything electronic. Some people don't have,
That's right.
these top of the line phones for
Yeah.
access to a lot of things. So we have to, when we're creating this type of things, we have to take that into consideration as well.
Hmm. And thank you so much for saying that because you're absolutely right. Um, I just think about my aunt who's 83 and she needed to do something. And so I sent her the link because that's what she asked for. Now
Mhm.
she's email, she does computer, but she wanted a download. And she's like, I can't find a place to download it because I don't want to put my information in the computer. And I
Mhm.
was like, oh, Auntie, I don't know if you gonna find that.
Right.
Like you can you can get the first part, but I don't know if the second part's gonna work. But I say that to say for those who have people who may not be as computer savvy, for those who are, tap somebody who isn't, and you can fill the survey out with them. Like
Yes.
I'm just thinking of if it's family time, it's coming up on a lot of holiday
Mhm.
activities and get-togethers,
Yes.
right? And to be able to sit down with family members and say, let's fill this out together. It's a great way to learn family history. It's
Yes.
a great way to connect on a deeper level. And it's a great way to help society as a whole.
That's
So, uh,
excellent.
yeah, I'm going to charge y'all with that. Look, y'all know I'm a teacher. Look, so
Yeah, that
I,
that's excellent if we're able to do that. Absolutely.
Dr. Wade said, leave it to Dr. Walls to come up with Mammogram Monday. We are witnesses.
Monday. Yes.
That's right. We're gonna go get mammograms and then we're gonna go get some tea and some cookies or something. We're gonna make it a good day. Yes, yes. But yeah, I appreciate you. So look, everyone in the chat room, there is, and as well as again on the YouTube side of life in the write up, there is the link for voices.cancer.org. I hope everyone who is listening will fill out this survey. Check first of all to see if you qualify,
Mm-hmm.
right? And then once you qualify, then fill it out and then share it. Let's say at least two people. Ask. Okay, let's say it's two people. You said they're trying to get how many people? 100,000?
100,000, and we've been doing it since May. I just became an ambassador just the end of September, and literally we only have about 2,300 people, women registered, and this is collectively 20
Yeah.
states, 2,300
Wow.
May. That number is extremely low, and again,
Uh-huh. Uh-oh, she disappeared.
change our
Diane, you went out.
messaging,
Repeat what
when
you.
how we mammograms are so painful, they
Hmm.
hurt, it's hard, like we have to change our messaging, we have to
Yeah.
change that when we're talking about screening. We, yes, it's uncomfortable, but it shouldn't be so painful and where we're discouraging somebody else from going. So I did
Yeah.
want to throw that in there, that we need to change our messaging when we're talking about getting screened.
Yeah.
But again, yep, we're trying to recruit 100,000 women, and
Okay.
we're at probably about, I think maybe about 2,500 if they're
Okay.
collectively with 20 states. So that number is
Wow.
really low. So we
Yeah.
need a push. We really, really need.
And is this just in the
And don't get
United States?
discouraged by the length of time.
Is this just in the United States or is this a global study? Uh-oh, Diane, can you hear me? I think she's having difficulty hearing us, y'all. Diane, can you hear us? Nope. I don't think she can
Can
hear.
you hear me, Kathy?
I can hear you.
Okay.
I can hear you. Can you hear
I
me?
can't hear you.
Okay. You might have to, let me see. I'm going to pull you out and then put you back in. Let's
Okay.
see. Can you hear me now? Still no?
No.
Oh, goodness. All right. I might leave the studio and then come back in.
Okay.
Okay. All right. So she's gonna join us again. We started with technical difficulties and look like we might end with a little technical difficulty. But what I want to find out is if it is a global study or if it is just in the United States. Because 2,300 versus 100,000, that's absolutely ridiculous. We got more people playing the lottery on a Monday, Tuesday, Wednesday, and a Friday and a Saturday. Not that I know when the Powerball and Mega Ball is, but we have to do better for our health. So check and see again. Go to voices.cancer. You think it's Dr. Ramatal? You think it's only in the U.S.? Thank you. Definitely go to the link. Check out voices.cancer.org. Again, you can go over to my Ask Dr. Walls 525 page, look in the write up, click it, see if you qualify for the study. Thank you, Ms. Ray. Thank you very much. All right, US only. Tag some people y'all know in other states. We all have people in different. Okay, yes, duh. It's backed by the American Cancer Society. Well, doesn't that make sense? Okay. So, yes. So we want to make sure we're tagging people that we know, and let them know. Look, it's going to take about 60 minutes of your time. Once you take it, see how much time it takes. Then you can tell the people honestly, it's going to take a little bit of time to complete it, but it's giving us information about us. One of the things that is often said when it comes to Black people, Brown people, is having us tell our story. We cannot tell our story if we don't participate with giving supporting details about our story. We cannot have medical treatment designed specifically for us if we do not take the time to provide the data that is needed so that the medication, so that the treatment can be designed for what we need and how we need it. All right. So again, it's taking 60 minutes to 90 minutes of your time. I will be filling it out. I'm going to tell you here right now. I'm going to take my time. I'm going to see if I qualify. And if I qualify, then I will fill it out. And I'm tapping y'all. I'm going to tap some other people who I don't see in the chat room to fill it out as well. The same way I send links out to the show, I'm going to send out this link as well. All right. Good evening, Leslie. Thank you for joining us. So I was waiting for Diane to come back in so she can say goodnight. I also put in the chat room the Bird Cancer Foundation.org. That is Dr. Nia Imani Bailey's website. She does a lot of work around cancer Um, and she is a tremendous resource. So you can check out her site. You can also reach out to her organization if you have questions, if you need help, if you know somebody that needs help. So, y'all know me on this show. I'm only sharing stuff that I find helpful and to be a resource to each of you as well as the global community. So, be sure to check those out. All right. It is the 8 o'clock hour. Y'all know it's Wednesday, so y'all know it's date night. So I got to go. I appreciate you all joining us this evening. I will be sure to have Dianne come back again. Hopefully, we won't have as many technical difficulties. Hopefully, we won't have any technical difficulties next time. If you are not following Ask Dr. Walls 525 on YouTube, I ask you to do so. Click that subscribe button, hit the like button. Be sure to watch the replays and also share. I'm super excited. I recently started a playlist called What I Learned Today. Here she done pop back in. We're going to get her to come in
Yeah.
and get ready to wave off. There you go. I did. I did not want to leave without you being able to say good night and anything else you wanted to share before we go.
Oh my goodness. I just thank you for this opportunity. I have no idea what's happening over here. But I am grateful, grateful, grateful for this time that we've had together. And I just want us to know that we have a voice and it matters. So
Yes.
join me in this fight.
Excellent. Excellent. Thank you so much for taking the time to make us aware of this study. Like I said, Dr. Motley and I, we talk about research and people participating in research, and it's not always our strong suit, but it is something that we need to be better with. And again, especially when it's with reputable organizations, when we know that it is ethical and we know that it is beneficial for us and our community so that we can actually start to get some answers
Yes.
and make a difference in the world now. We get 100,000 people and start to be able to assess what's going on. We might be able to find some answers within the next year, 2 years. But if it takes us 2 years to get 100,000 people, then we're pushing
Pushing.
results out another two plus years. So the faster we can get people get to that 100,000 mark, the faster we can start to create some healing opportunities for
And
people.
they'll follow it up. You'll continue. They'll continue to
Yeah,
follow you every year. You'll get a survey, and we'll be able to see, has anything changed over time.
exactly. So takeaways for today. Let's give it to them. They need to do what?
Takeaways for today. We still know that early detection really does save lives. So get your
Yes.
grams. Don't
Mm-hmm.
assume those closest to you are getting screened.
Mm-hmm.
All right. We gotta bind together and encourage one another to take care of ourselves overall. Take care, know
Mm-hmm.
your family history, know
Yes.
what your risks are, and then support one another in this journey and in this fight. We've made great strides, but we've got a ways to go.
That's right. I love it. We're going to keep on walking. This
Yeah.
journey is not over, and we're going to contribute positive seeds along the way so that we create a tremendous blessing and harvest for those that come after us
Yeah.
as
And sister,
well.
will you help me? Yes, my
Yes,
sister, I will.
I love it. And people who want to be a part of Sisterhood, will you help me? What do they need to do?
They could just share. You can share my contact information. I do it right out of Cooper Hospital the
Uh huh.
second Thursdays of the month. And then it's in the Willenboro Library, which is in Burlington County here in New Jersey, first Thursdays of the month.
Okay. And so if they want to get in contact with you to find out more, should they contact you at the hospital?
Yes, they can.
And how do they do that?
Phone number first is 856-735-6258. And then my email there is Hyman, Hyman, hyphen Dianne, Dianne, at cooperhealth.edu.
All right. So this means y'all gonna have to watch the replay so you can hear the phone number and the email back. Look. Diane, as always, thank you, thank you,
Thank
thank you.
you. I
You're
thank you for the time.
welcome. You're
Yeah.
welcome.
Thank you all for joining us.
Yes. All right, y'all. Y'all definitely go over here to voices .cancer.org. See if you qualify. Go through it. Don't make an assumption if you do or if you don't. Go through the criteria and let them let you know if you qualify. And if you do, if you don't, whatever, still pass it on. Find two more people that you can send it to and encourage them to do it as well. And let's help get to this 100,000. If
Yeah.
I would look, if this were a raffle to win $100,000, I think we get 100,000 people. This is a
Yeah.
raffle to help people live a longer, more prosperous, and fulfilling life. So let's contribute to that raffle by filling out this questionnaire. All
Yes.
right. All
Awesome.
right, y'all. So
Be
until we
great.
meet again, y'all know I'll be popping up with some shows. Oh, I got one next Thursday at 7 p.m. about forgiveness.
Okay.
So, it's been a hot topic this month of October as people are preparing for the holiday season. There may be some forgiveness that needs to happen before these dinners and holiday parties come up. So be sure to join us back here on Ask Dr. Walls 525 Walls of Wellness for that forgiveness episode. So I'll see you on Halloween Eve's evening. So it will be a trick and it will be a treat. So we'll see you then. And until then, y'all continue. God bless. And as always, continue to live your greatest life. See you next time. Bye.